Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Emotion Regulation Questionnaire assesses individual differences in the habitual use of two emotion regulation strategies: cognitive reappraisal and expressive suppression. It evaluates how individuals manage and modify their emotional responses to stimuli. The main purpose is to provide a reliable measure of these strategies for research and clinical applications. This tool aids in understanding emotional processes in conditions such as anxiety disorders, depression, and post-traumatic stress disorder. It supports the identification of maladaptive regulation patterns that may contribute to psychopathology. The questionnaire consists of items rated on a Likert scale, ensuring standardized assessment across populations. The Emotion Regulation Questionnaire is indicated for adult patients across diverse clinical populations, including those with mood disorders, anxiety disorders, and personality disorders. It is most useful in contexts requiring assessment of individual differences in habitual emotion regulation strategies, such as cognitive reappraisal and expressive suppression. The tool aids clinicians in identifying maladaptive emotion regulation patterns that contribute to symptom severity and treatment resistance. It has demonstrated reliability and validity in outpatient and inpatient psychiatric settings, facilitating targeted therapeutic interventions in cognitive behavioral and emotion-focused therapies. The Emotion Regulation Questionnaire consists of 10 items designed to assess individual differences in the habitual use of two emotion regulation strategies: cognitive reappraisal and expressive suppression. Each item is a statement related to these strategies, and respondents indicate their agreement using a 7-point Likert scale ranging from 1, strongly disagree, to 7, strongly agree. To administer the questionnaire, instruct participants to read each item carefully and select the response that best reflects their typical behavior in emotional situations. After completion, calculate separate scores for cognitive reappraisal and expressive suppression by summing the responses to the 6 and 4 relevant items respectively. Higher scores in cognitive reappraisal indicate a greater tendency to reframe emotional events positively. Higher scores in expressive suppression reflect increased use of inhibiting emotional expressions. Reference values suggest that average cognitive reappraisal scores typically range between 30 and 42, while expressive suppression scores range between 16 and 24 in normative adult samples. Scores significantly above or below these ranges may indicate atypical emotion regulation patterns warranting further clinical assessment. Sensitivity refers to the ability of a test to correctly identify individuals who have a particular trait or condition, while specificity indicates the ability to correctly identify those who do not have it. Regarding the Emotion Regulation Questionnaire, published studies have not consistently reported sensitivity and specificity values because it is primarily a self-report measure, assessing habitual use of emotion regulation strategies rather than a diagnostic tool. In clinical contexts where cutoff scores have been proposed, sensitivity values have ranged around 70 to 80%, indicating a moderate ability to detect individuals with maladaptive emotion regulation patterns, whereas specificity values have typically been between 65 and 75%, reflecting moderate accuracy in excluding those without such patterns. For example, if used to screen patients for difficulties in cognitive reappraisal, a sensitivity of 75% means that 75 out of 100 individuals with poor reappraisal skills would be correctly identified, while a specificity of 70% means that 70 out of 100 individuals without these difficulties would be correctly ruled out. This underscores the tool's role as an adjunct rather than a definitive diagnostic instrument. The Emotion Regulation Questionnaire was developed by James Gross and Oliver John in the year 1993 as a self-report measure designed to assess individual differences in the habitual use of two emotion regulation strategies: cognitive reappraisal and expressive suppression. The initial validation study conducted by Gross and John demonstrated strong internal consistency, with Cronbach's alpha coefficients exceeding 0.8 for both subscales across large samples of college students. Subsequent research has replicated these findings across diverse populations, including clinical and non-clinical samples, showing satisfactory test-retest reliability over intervals ranging from 2 weeks to 6 months. Construct validity has been supported through correlations with related psychological constructs, such as emotional well-being, affective experience, and social functioning. For instance, cognitive reappraisal scores have consistently correlated positively with measures of psychological well-being and negatively with depressive symptoms, while expressive suppression has shown opposite associations. Factor analyses confirm the two-factor structure originally proposed, establishing the questionnaires' dimensional integrity. Furthermore, cross-cultural studies indicate the Emotion Regulation Questionnaire retains its psychometric properties across different languages and cultural contexts, highlighting its broad applicability. Overall, the accumulated scientific evidence underscores the measure's reliability and validity as an instrument for assessing key dimensions of emotion regulation. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.